Hello, hi, my name is Dr. Tarak Patel. I'm a pediatric pulmonologist in the community. We'd like to share some insight of what you might have seen in the news lately. RSV, which is the word for respiratory syncytial virus, has had a dramatic increase in a number of cases in our community. We've seen at least a threefold increase at Methodist Children's Hospital, ER, and we've seen a significant increase in number of children being admitted to the hospital because of it. Why is this happening in the summer? This virus typically happens in the winter months, but we feel or we suspect that because we've had such an immense lockdown over the last year due to mask wearing and quarantining and limited travel, that the other viruses that normally would have been active in the community were not significant at all. I would say last year I saw 0 cases of RSV. Here's what you should look out for if you suspect your child may have RSV. RSV is very similar to many of the other viruses that are in the community. However, in the very young infant and young children, especially with asthma, and the elderly, it can have significant effects involving the lungs, which is called bronchiolitis. Many of these symptoms could be cough, wheezing, increased worker breathing, runny nose, congestion. In the infants, it can be seen with irritability and even pauses in your sleep, such as apnea. If you suspect any of these signs, you should treat them similarly as you would for other viruses. But as these symptoms start to increase, I would seek out your primary care physician or provider to help with assessing and if additional treatment may be needed at that time. RSV has been around for many years, and it can pose a significant health risk for your child and infant. It's associated with an increased number of hospitalizations, as we're seeing currently. There are very basic steps you can do for prevention. RSV tends to be droplet-borne, and so hand washing is very important, minimizing rubbing your nose and your mouth. Similarly, what we've done in the past as we're going through this pandemic. If you are premature, have congenital heart disease, you may be qualified for a preventative vaccine type medication that we do on a monthly basis during the season. We typically start this injection in the fall, winter months. However, because we've seen such a big uptake throughout the state, we are now starting the process early and already started administering the medication over the last 2 weeks ago. Furthermore, other centers are doing studies like we are, in which have newer vaccines for the late term and infants who are interested in receiving this preventative measure as a possibility.